Okay.
Okay.
So, hi, how are you doing today?
I'm good. Thank you so much.
Okay. Thank you so much for meeting with us today and conducting this interview. We really appreciate it. To start off, can you please introduce yourself and what you do?
Yes, my name is Dr. Ramya Niranjan. I am a pediatric dentist by profession, and I work in a private practice in Livermore, Turlock, and also in Tracy. And I'm also Mrs. India Queen of Substance 2021. So I won the pageant at the national level. That's
That's
about me in
amazing.
a nutshell. I
Congratulations.
have 3 kids, and they are 12, 10, and 6.
Okay. To give you a better idea of our project, we would like to present you with a short slideshow.
Okay.
And here it is. And this is our community awareness project, which is increasing the number of primary care physicians in California.
Nice.
So the issue that we're looking at is that in California, there's a severe lack of primary care physicians, and it's making it more challenging for locals to get access to treatment. It's increasing wait times for appointments, and it puts more strain on the healthcare system. The state of California is in need of around 4,700 extra primary care physicians in 2025 and about 4,100 additional primary care clinicians in 2030 to fulfill the demand, which is according to mid-range predictions. It's vital that efforts be made to increase the number of primary care physicians so that there isn't a burden on the healthcare system and patients' health aren't impacted. And the image on the right shows the amount of primary care physicians per area in California. And it's clear that the majority of California is in the shortage or the insufficient range. And our goals for this project are to inform, educate, and raise awareness about the shortage of primary care physicians in California and how it is affecting the general community. By launching this campaign, we will be able to work to educate and inspire more aspiring medical professionals to choose careers as primary care physicians. And this would educate individuals about the profession of primary care physicians, the shortage of them, and the consequences that shortage has for our community and our state. We selected this issue because the region that we reside in, which is the San Joaquin Valley, is one of the many that is facing an extreme lack of primary care physicians. If the amount doesn't increase in California, then it is possible that mortality rates, wait times for appointments, and the amount of patients with chronic conditions might increase due to the lack of primary care. Because of this, we knew that it was vital to help support our community by working towards helping California's shortage of primary care. And then we have our website along with our email and a few social media platforms to contact us with. And thank you.
Great. That's such a great project. That's excellent. That's awesome. So, I actually worked in public health before I went into specialty. I was actually working more towards Valley, which is, which is a healthcare provider shortage area where you don't have a lot of primary care physicians. I actually worked to open up Livingston Community Clinic. It's like bang in the middle of Valley. And it was the only community health services that actually opened up for low income population. They didn't have any dental services prior. So we helped open up Livingston Community Health. So I'm very much aware of what's going on with the shortage area here with the shortage of primary care physicians in and around this area. And I think San Joaquin is one of them. But as you go inside, you will see that there's excessive lack of shortage of primary care physicians. It's extremely difficult to actually find a provider. I personally commute all the way to Turlock because they can't find a specialist in that area.
Wow.
I
Okay.
think that's a great project. That's excellent.
Mhm.
I think this is
Thank you.
just amazing. What a great topic.
So, we had a few questions for you today. And you kind of answered this one already, but do you think you can go more into depth about what you think so far about the lack of primary care physicians in California?
Yeah. I think a lot has to do, people like city life, right? So you do have people who actually they are from these short healthcare provider shortage areas. but we don't have a lot of med schools in and around here in Valley. So I think, as you know, UC Merced, I think that's a great step towards actually being able to keep physicians in and around the place, because most people, they want to actually migrate towards Bay Area, which is already super saturated with healthcare individuals, because they, people choose to lead a city life. But again, what I think is, if we can encourage more people who actually reside in Valley, who are natives of Valley, they have their homes in there, base in there, and they know that they have to actually come back home, and encourage those individuals to actually apply for med schools, or dental schools, and stuff like that. I think those are the students or the individuals who will actually come back home and serve their community. Versus, I think, we have a lot of out of state individuals, or individuals from other areas, who actually come in, and who actually become doctors, but then they go out and actually practice. So in a lot of ways, we are actually not serving uh, the shortage areas, because everybody's coming, they're getting educated and actually moving out. So that's not really helping. Some of the incentives that actually healthcare provider shortage areas they provide to individuals are, they actually encourage uh, students to actually work in community clinics, and they offer loan repayment. And that's one of the very strong incentive for people to actually work in public health. So yeah, so those are some of the things that actually um, here the schools and things offer to be able to work with public health and low income population.
Thank you for telling us that.
Yeah.
Our next question is, do you think people know about this problem, or do you think that they need to be more educated on this issue?
I think a lot of healthcare providers as such, they know about the issues. They already know. What we need to do is probably target the aspiring medical students, or the aspiring students, to actually make them more aware of this issue, so that way they know where they actually have to, where there is need, right? So for example, loan repayment is a great incentive, right, for anyone to actually come back and actually serve the community. They do have a contract where they say, 2 years you serve in an underserved community, and we'll do so much of loan repayment, and we will pay this much of money towards your student debt, which is a great incentive. So these are the things that needs to be brought into light. And probably, you have fairs and counseling sessions, right, where you have the aspiring med students, dental students actually trying to apply to schools. I think that's where we have to actually bring this to their attention, that something like this does exist. So if they choose to go to medical profession, and if they choose to work in an underserved community, this is something that they will have towards their loan repayment. And as you know, in this area, there might be many individuals who might be the first generation to go to school, or to go to med school or dental school, or things like that, because we do have a lot of disparities in the socioeconomic status in these areas.
So focusing more on those who want to be med students and dental students.
Yeah, and also making them aware of the opportunities that are actually available. There are scholarships, there are things that are available for students who actually want to get into schools. If they are first generation kids who are actually getting into schools and colleges, they do have preferences in med schools, dental schools, and stuff like that. And making them aware of loan repayment and what other things are available for them, I'm sure that that will actually help solve the shortage that we actually have in and around this area.
Yeah, we definitely agree with that. And our next question is, what do you think are some possible solutions to this issue, and who or what would be involved with it?
So, what I would do is I would actually probably write a letter or something like that to actually the medical association, when they actually, colleges, approaching the colleges would be another thing where they actually have their sessions or fairs and stuff like that, where they target the pre-dental or the pre-medical students, encouraging them. These will be some of the things that could be brought into light or spoken about at that time. And probably, then that way students can plan and they already know what is in store for them, or what are their options and things like that before applying to med schools. There are other things that can be done, which is you can write to the community leaders here, probably bringing up the issue to their notice. So that way, when you have community gatherings or meetings and stuff like that, one of you can actually, take up an opportunity to actually go ahead and talk to them in those, when they have such kind of fairs or get-togethers and meetings like that. So I think those will be some of the things that you can do.
Yeah, definitely. I think we could definitely try to do that. Our last question is, do you have any feedback for us on what we should improve on?
I think this is a great project. This is excellent. And I think, we all need to start somewhere. So I think this is amazing. This is like, one step at a time. And then this is just at this level. Then slowly you can actually go and speak about it in bigger gatherings and meetings. And that's where you'll be able to target more students or aspiring healthcare providers. And I think eventually you'll make a big difference at a state level. But this is like the right way to start upon.
Thank you.
So that was our last question. Thank you so much once again for meeting with us today. We really
thank you so much. That is excellent. Thank you. It was very nice meeting you all.
We appreciate you taking the time to meet with us.
Thank you.
We definitely learned a lot from this. Thank you so much.
Yeah. Also, do you mind?
I just wanted to tell you. So if you let me send you. I will probably send you a link as well about my interview when we actually opened up the community health services and things like that. So you can actually see what we exactly targeted. And it's been we opened these services in 2015. So I'm kind of little rusted, but I have an interview that I will actually send it to you, so you can actually read more about healthcare provider shortage areas and who are the people we actually targeted, and how our community health services can kind of improved the life of people in there, because we were the first ones to actually open up community health services in there. And these are so important, because as you go more and more towards Valley, you will see that you have a lot of immigrants in there who don't have any access to healthcare at all. Not at all. And it's actually extremely sad. I one thing that's so vivid in my mind, which I can never forget, is I saw a 12-month-old baby who came into the clinic, and I saw 20 teeth in the mouth, all rotten. And I knew that this kid actually needed extractions. There is no way any of this could be saved. And but for such a young child, the only way to actually save anything, like a 1.5 or 2-year-old, is just by putting that child to sleep. But this mom didn't have any insurance to be able to do that. She couldn't. So there are certain things where even public health is kind of limited. There is only so much you are able to provide. And that is also because there are not a lot of specialists or doctors who would actually take this up, because they were low-income population, to be able to treat them under GA. So if we had anything of that sort, that would have been awesome, right? But then this is just not a barrier. The barrier of access to care is just part of it, right? There are places which actually accept low income population, and actually there are places which actually give access to this, but guess those people have to travel such long distances to those places. They don't have the modes of transport to actually travel to those kind of places, and the wait time is over 6 to 9 months. So there are multiple challenges at different levels that actually we have to encounter. And also improving the literacy of people or the community is extremely important, right? Prevention is the key for a lot of things. So improving the literacy and improving good practices, and at what point they need to see the doctor, and like vaccinations and things like that. There's so many things that we need to educate the community upon.
And I think that's exactly why we brought this topic, this issue up, because we want to be able for everyone to get the care that they need when they need
And
it.
help our community.
Yes, and you know what? It's just not even like language is a barrier as well, right? So that is one of the things that you will need to address too, right? It's not everybody understands English. Spanish is like another main language, right? Even if you have aspiring students, and there are people for whom language is a barrier. So getting across to them in multiple languages and making sure that they understand what you're trying to tell them is also important.
Yeah, it helps that California is such a diverse state, and we have that advantage amongst other states because we're like very diverse community, and that's why I want to encourage different groups of people so it's easier to interact with the patients.
Yeah. Another thing that is done at a state level is lobbying, advocacy, right? You go meet the Congress members, the leaders, you start at the community level, then you also have members at Congress level that you actually go ahead and meet and speak to them and advocate for what you are actually doing. And they have, and that is where everything lies. That's where the power is, right? Definitely, that's where how we bring about the change, by lobbying and actually being an advocate as well.
Yes, that's very true. I want to thank you again for taking your time out of your day to join us and help us with this.
Absolutely. Good luck to you guys. Thank you so much.
Thank you.
Do you mind if we take a picture of this?
Not at all, not at all.
Okay. 3, 2, 1. Okay, got it.
Thank you so much.
Okay. Thank you so much.
Bye. Thank you
Bye.
for waiting. Bye-bye. See you.